I'm Dr. DeShawn Taylor, board certified gynecologist and family planning specialist, coming to you today from Phoenix, Arizona for the second installment of my two-part series on Is That Bump an STI? I'll give a moment for folks to realize that we're live and come on in. All right. Welcome. Thanks for tuning in with me today. And if you are viewing this recorded and not live, I hope that you will share this information if you find it useful to you. And I am going to go ahead and jump on in here. Thank you for bearing with me, starting a little bit late today. But let's jump on in. So again, I'm Dr. DeShawn Taylor. I'm a board certified gynecologist and family planning specialist. I am the owner of There's a Star Family Planning in Phoenix, Arizona, that provides general well woman care, acute gynecology care, outpatient services, as well as gender affirming care and STI testing and treatment for women and men. And so I come live every second and fourth Wednesday to discuss topics with you all that are relevant to my practice, and also sometimes questions that people may ask on our different platforms. And so during my last discussion, I went over different causes of bumps in the female genital area and went into a more detailed discussion specifically about genital warts. And so today I am going to discuss genital herpes. And so to refresh here, both genital herpes and genital warts are sexually transmitted infections. They are spread through skin-to-skin contact and are caused by a virus. But the viruses that cause these conditions are different. The human papillomavirus causes the genital warts, and then the herpes simplex virus is a virus that causes genital herpes. So let me repeat that. The human papillomavirus is the virus that causes genital warts, and the herpes simplex virus is the virus that causes genital herpes. Now, there is no cure for either genital herpes or genital warts, but there are medications that can help you manage the symptoms of herpes and treat the complications of HPV infections that can cause genital warts. So genital warts is caused by two types of herpes virus, herpes simplex 1 and herpes simplex 2. 1 in 5 women ages 14 to 49 is living with genital herpes. And a woman's anatomy puts her more at risk for genital herpes than men. Small tears in vaginal tissue can make it easier to get genital herpes. 1 in 10 men ages 14 to 49 are living with genital herpes. And again, there's no cure, but you can take medication to prevent outbreaks and also lower your risk of passing genital herpes to your partner. Genital herpes is spread generally through vaginal, oral, or anal sex. The virus is spread through contact with open sores. You can also get herpes, though, from someone without any symptoms or sores. This is called viral shedding. Some other ways that genital herpes can be spread is through genital touching, in childbirth from a birthing person to the baby, and breastfeeding if the baby touches an open sore. It is also possible to get genital herpes if you are a woman who only has sex with women. So it is so important to have a conversation with your partner about their sexual history before having sex. And also be sure to ask your healthcare provider for testing if you have any signs or symptoms of genital herpes. And I'm going to go through some of those with you during this discussion. Also use a dental dam during oral sex to avoid getting herpes during sexual activity with oral sex. And interestingly, I had a patient about a year ago who was diagnosed with her first herpes outbreak due to sores appearing on her face. And that was very distressing for her. So a little bit more about the differences between the herpes viruses. HSV1 is often causing infections on the mouth and lips, and we refer to these as cold sores or fever blisters. These symptoms are often milder than genital herpes, and you may get fewer outbreaks. It can be spread to the genital area during oral sex and cause genital herpes. HSV2 is the most common cause of genital herpes. It is spread through vaginal, oral, and anal sex. And so herpes simplex virus 2 can spread to the mouth during oral sex. So an additional note about HSV1, if you have a cold sore on your mouth and you've not been sexually active in a way where you can get genital HSV2 to your face, then you generally have HSV1. And that is very common. Importantly, understand that you can pass HSV1 by kissing someone, sharing utensils, towels, razors, or lipstick with someone who has an active cold sore. HSV1 cannot turn into HSV2. I'm going to take a moment. Sorry about that. Seems like my allergies always want to act up when I'm live streaming. So where was I? So HSV1 cannot turn into HSV2. But you can, again, get a cold sore on your mouth from HSV2 if you give oral sex to someone with HSV2. Again, you can pass HSV1 to the genital area if you have a cold sore and you are providing oral sex to someone. So it's so important that when you have cold sores, that you do not touch other parts of your body, that you do not touch other people after touching your open sore. You want to avoid touching your cold sore as much as possible. If you do touch it, please wash your hands. And again, avoid spreading infection to other parts of your body or to other people. Now, most people with genital herpes do not know that they have it. But if you do get symptoms with that first outbreak, especially for women, it can be very severe. Genital herpes can also be very severe and long-lasting in people whose immune systems do not work properly, such as in people with HIV. Within a few days of contact with someone who has the herpes virus, sores, which are generally small red bumps that may turn into blisters, may show up where the virus has entered your body. So it can occur in the vagina, around the anal area, or in the mouth. And so sometimes people may confuse mild sores with something else, but after a few days, the sores will become crusted and then ulcerated, which can cause some pain, rubbing against your clothing, underwear, with urination, but they do heal without scarring. And sometimes a second set of sores appear soon after the first outbreak. And so the symptoms can happen over and over again. The other important thing to note is that the first signs of genital herpes usually show up within 2 to 12 days after having sexual contact with someone who has herpes, and the symptoms can last from 2 to 4 weeks. Now, some early signs before the bumps start to occur would be feeling of pressure in the abdomen, flu-like symptoms, including fever, itching or burning in the genital or anal area, pain in the legs, buttocks, or genital area, and swollen glands. Women can also have an unusual vaginal discharge. So please see your healthcare provider if you have any of these symptoms, which would be concerning for genital herpes. Oftentimes, I can diagnose genital herpes just by looking at the visible sores. However, I will still use a cotton swab to take a fluid sample from the sore to send it to for confirmatory testing at the lab. Genital herpes can be hard to diagnose between outbreaks, though. If there's not any visible sore there, then blood tests that look for antibodies to the virus can help diagnose herpes in people who have potentially been exposed, but may not have experienced symptoms. Genital herpes is a lifelong disease. Remember that there is no cure. And even though you may not have outbreaks for long periods of time, you can still pass the virus to other people. So antiviral medications can be prescribed to prevent or shorten outbreaks during the time that you take the medication. Also, daily use of the medication called suppressive therapy may lower your chance of spreading the infection to your partner. So have that conversation with your healthcare professional about whether you would just need medication on hand for outbreaks, which is called episodic therapy, or whether you would benefit from taking the antiviral medication daily for suppressive therapy. During outbreaks, you can take the following steps to speed healing and prevent spreading herpes to other parts of your body and to other people. Keep the sores clean and dry. Try not to touch them. Again, wash your hands after any contact with the sores. And also, it is very important to avoid sexual contact from the time you first notice symptoms until the sores have healed. There are some comfort measures that may be helpful if you have a very severe outbreak. Place a thin film of Vaseline along the external vulvar area to ease the friction between clothing, undergarments, and sometimes sitz baths, which is you put a little bit of water in your tub and you sit there and soak with a little bit of salt solution can help as well. But over time, it just needs the time and your help of the antiviral medications to help break the outbreak. I want to provide a special note about genital herpes in pregnancy and breastfeeding. If you get genital herpes during pregnancy, you can spread genital herpes to the baby during delivery. If you've had a genital herpes outbreak prior to pregnancy, there may still be risk there, but the risk is lower. Generally, the obstetrician will prescribe an antiviral medication to reduce the risk of spreading the virus or having an outbreak around the time of your delivery. So again, it's really important to have these discussions with your healthcare provider. Most women with genital herpes have healthy babies, but babies who do get herpes have a condition called neonatal herpes. And this is a serious condition that can cause problems in the newborn, such as brain damage, eye problems, or even death. You can breastfeed if you have genital herpes, but not if you have a herpes sore on one of your breasts. Now, remember I said that when you have active sores, then they can be transferred to other parts of your body. And so that can include your breasts, including your nipple and areola. So if you have genital herpes sores on one or both of your breasts, if you can continue to breastfeed, or as long as the baby or the pumping equipment does not touch a herpes sore. Do not breastfeed from the breast that has sores. Pump or hand express milk from the breast with sores until the sores heal. It's really important to pump so that you can keep your your milk supply and prevent your breast from getting overly full and painful, and you can store the milk to feed later. But if parts of your pump touch the sore while pumping, then throw the milk away. And so the best way is prevention to avoid genital herpes or any sexually transmitted infection. So not having vaginal, oral, or anal sex is the best prevention. However, if you do have sex, lower your risk of getting herpes or any STI with the following steps: condoms, condoms, condoms. This is the best way to prevent sexually transmitted infections when you have sex. Because the person with the penis does not need to ejaculate to give or get some sexually transmitted infections, please be sure to use a condom on the penis before it touches the vagina, mouth, or anus. Other methods of birth control, including diaphragms and cervical caps and sponges, will not protect you from sexually transmitted infections. Get tested. Be sure you and your partner are tested. Talk to each other about the test results before you have sex. Having sex with one partner reduces your risk of sexually transmitted infections, especially after being tested and you know that you're both negative and you're faithful to each other, meaning you're not having sex with anyone else. That decreases your risk of getting sexually transmitted infections. Limit your number of sexual partners. Your risk of getting an infection goes up with the number of partners you have. Do not douche, please. Douche and remove some of the normal bacteria in the vagina that protects you from infection. This may increase your risk of getting sexually transmitted infections. And avoid alcohol and drug use if you can. Drinking too much alcohol, using drugs can increase your risky behavior, and that could put you at risk for exposure to sexually transmitted infections. All of these steps work best when used together. No single step can protect you from every single type of sexually transmitted infection. All that I ask that you do is, when you are sexually active, make your best effort to protect yourself. And I hope that this information has been very helpful to you. This ends part 2 of my 2-part series, Is That Bump an STI? And if you missed part 1, you can watch those on our platforms, Instagram, Facebook, and YouTube. And I hope to see you the second week of December for my next topic. Feel free to drop any questions to us in our Instagram DM. And if you have any topics you'd like for me to discuss, reach out to us. Let us know. You guys have a great rest of your Wednesday. Happy Thanksgiving, and see you next time.